Welcome to the Cheer Athlete. This week we're going to talk about injuries that are not necessarily preventable because they happen during growth periods, but that there's absolutely things you can do to reduce the risk of reduce the pain and not have it stop your athletes from sitting out. So we're going to talk about Osgood Schlatters and Sever's disease because they're very similar in their nature and how they present. Welcome to the Cheer Athlete Podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. As far as the reasoning behind why there's pain. Osgood Schlatters is a deficit at the knee that it's an irritation at the knee, right where the tibial tuberosity, where that meets where the tela or the kneecap, the tela tendon attaches at the tibial tuberosity. So I don't have a knee joint to be able to show you, but if you feel your kneecap and go down to the kneecap is a triangle shape, go down to the bottom of your kneecap, and then just about maybe an inch to an inch and a half below that, there's a little bump in the bone. So that bone is your tibial tuberosity, and the bone is the tibia, and the bump is the tibial tuberosity. And that's where your quadriceps attach. Quadriceps attach at the hip, and then there's four muscles. They come down, they attach in the quad tendon above the knee, and then it's a longer tendon that goes down over the kneecap and down into that tibial tuberosity. So when there's a big growth spurt, the quads may not keep up with the length, and it pulls on the bone and it creates an irritation and inflammation. A lot of times you get an actual palpable bump there, and that's what's Osgood Schlatters. Now, if you Google this online, they're going to tell you it's because your hamstrings and your quads are tight, and we need to stretch and loosen the quads and the hamstrings. I do find that they can be tight, but tightness doesn't mean that it needs to get stretched. Tightness means that there's dysfunction in the muscle. So in the quadriceps, that dysfunction could be that they're tight or it could be that they're weak. And same on the hamstrings. A lot of times I find that the hamstring and the quads actually counterbalance each other, or they argue against each other. One's trying to overwork and the other one is like, oh, you do the job. I'm not going to do anything. And the hamstrings are like, I want you to do some work. And the quads are like, nope, I'm not going to. And or vice versa. So they're a very common pair. And when you have something on two sides, if you have Osgood Schlatters on two sides, that's likely coming from your core because their quadriceps are tightening down like guide wires. If you live in Massachusetts, you know the Zakim Bridge, right? Those wires that they're all like post this way. It's a beautiful bridge, but they're strict. They're solid and tight, and they are meant to just kind of keep things and keep that suspension in line. So your muscles will do the same thing if there's weakness above. And the hamstrings and quads are two key muscles groups that will do that when there's dysfunction at the pelvis and the core. So what I find most of the time in the clinic when kids come to see me, they're not so much that they need to loosen their quads up. It's more that they need to strengthen in through their core. So sometimes I will do some stretching in the quads. A lot of times I do some rolling, like massage. The actual foam roller, I think, is torture. So don't do that a lot for the quads and the IT band anymore because it just hurts. And well, who needs to be tensing so tight? But I love the tiger tail stick, or there's an actual stick called stick that it's like a rolling pin, and you don't need to go buy something. Just use your rolling pin at home and just gently massage and roll in through the tight area. That will help to get some blood flow into the tissue, and over time it helps it to relax. Then you could go and stretch that. But then in order to stop that guide wire effect, you need to stabilize at the core. And so this might mean doing some planks. Crawling is a huge exercise that I use a lot with anyone with a growth plate dysfunction, Severs or Osgood Schlatters, because crawling will stabilize the core and strengthen the hips at the same time. Let's back up just a little because I'll talk about the exercises, which are very similar that I'll do for Severs and for Osgood Schlatters. Severs is the same deficit it happens when kids are growing. There's your calf muscle, there's gastroc and soleus, and then your toe flexor muscles all attach to the common tendon at the heel. And then if you feel your heel just above like the bottom of the foot, I do have an ankle. So this is your calcaneus, your heel. This is your tibia, your fibula, and then your foot. So the calf muscle comes down the back and attaches at the bone at the end of at the calcaneus. And that's where it gets irritated when you have Severs, is that it's right around, it's like an Achilles tendonitis, but it's at the growth plate of the calcaneus. And so it happens when, you know, your calf muscles aren't staying as flexible and you grow, and that kind of pulls on that bone and can be quite painful, can cause a bump as well. So same, you know, they when I say like stretch your calves, or a lot of times the calves might need to get stronger. A lot of times your calves are overworking for your quads or your hamstrings or your glutes. Two big muscle groups that I find that are not the core that need to get strong, your quads and your glutes, in relationship to the Severs. In the Osgood Slatters, a lot of times your quads may need to loosen and your glutes need to get stronger. So we're not just looking at the site of dysfunction, the knee and the ankle, but we're really going to look at the hips, the core, and I like to work and create developmental positions, or review developmental positions, because a lot of kids, I find, they didn't spend a lot of time crawling, and they didn't develop that coordination, and they didn't develop that core stability that is huge for babies. You watch a baby, you know, from beginning to the time that they're walking, they need to turn their head first. They track with their eyes, then they turn their head, then they start to roll, then they press up onto their elbows, then they push up into all fours. Maybe they're rolling and coming up into sitting, and then they start to crawl. And then once they start to crawl, they start to climb up onto, you know, holding on and getting onto their knees. And eventually one knee comes up and they are able to just then squat and come to stand. It's blissful watching a newborn transition to walking. I like to see kids walk in the 11 to 12 month range. I'd rather have them crawl for longer. You know, they usually start to crawl in the 9-month range, and they're starting to sit on their own at that time also. When they start to do that and they go for a longer period of time, they're really developing a reflexive core stability. That is hugely important for all of us. But for cheer athletes, it's really important because that's like that reflexive stability we need when we are basing or flying or any of that. So going through developmental positions and seeing, can they roll from their lying on their back over onto their stomach, or from their stomach onto their back? Can they do it leading with their arms? Can they do it leading with their legs? And, you know, following an object, does their head and their eyes track? Those are all key things to see once they start to kind of get that coordination down and loosen it. The benefit, like if your hips are tight and you're rolling from your stomach onto your back, leading with just your legs, you're getting a nice stretch through your leg, and it usually feels really good. At the same time, you're working your lower leg and your lower core. Same thing going forward, like if you're coming over from your back onto your stomach and you lead with your leg, you're going to get some nice hip flexor work, get some glute stretch, and you get some anterior core work at the same time. So you're working core strength, you're stretching out your hips, you're doing it all just by rolling from stomach to back. Then I get up onto, can they hold onto their elbows into a prone prop position? That really builds a stability through their lower back. And it stretches things out, gets some upper back stability, and gets postural control. Then we come up into crawling. Now, if it's really uncomfortable, I don't have them crawl for a long period of time. I'm not going to torture your kid, but putting a pad underneath their knees just to get there and get some comfortable weight bearing. And as they're able, starting to be able to crawl and baby crawl, knees down, making sure their alternate pattern is stable. I like to use this as a core stability. So I'll usually put a ball on a kid's back to make sure their hips aren't doing this as they're starting to crawl, but they are really able to keep their core stable as they move their arms and their legs. Which, if you think about it, when you have a flyer in the air and they're pulling a stunt, they need to keep their core still and move their arm and their leg. If you're a base, you need to keep your core still as you're putting things up overhead. If you're a tumbler, you need to keep the core still and have enough mobility there to with your in your upper body to be able to stabilize and get your tumbling over. So crawling is an exercise that's excellent for everybody once they can tolerate kneeling on it. They can't tolerate, again, hardwood floors, not the place to be for someone that's got knee pain. But on a cushion and doing it in short distance, if I'm having in the clinic, I might have do it on a mat because it's like a table because it's softer. And then balancing on one knee, or coming up onto two knees and then balancing on one knee and really getting that hip stability and looking to see, can we get your hips level and across? Once they transition and they can maintain a good neutral position where their ribs are down, their pelvis is level, they can balance on the one knee without wobbling and falling over, then we can get up into stand and really work on more dynamic and functional strength training. Things like single leg deadlifts, single leg squats. That single leg squat is going to put a lot of strain through the Osgood Schlatter, so they may have to modify that and do a two-legged squat until that gets more comfortable, maybe from a higher surface. There's all kinds of varieties, but the key for both Severs and Osgood Schlatters is create that dynamic developmental positions. Make sure they can do that first. That really helps to kind of deload the quads and the calf, and then stabilizes at the core. Everybody's different and everybody really needs an assessment, and because the variety of exercises and how everybody presents and how kids are growing and where the soreness is, it all varies. And so it's really important to get assessed. Those are my standard exercises to go with, and then making sure that we have hamstring flexibility and strength as well. And all of those developmental positions will help that to keep that balance. For the Severs, maybe the difference I still going to have them crawl, but we might get up into kneeling a little faster. And then maybe we do a little ankle mobility, but we're balancing on that one knee and getting the hips good and strong, getting the hips open so that the calf doesn't have to work as hard. Progressing, I love step ups as a exercise for both. I like a higher step for a step up. So generally I'll have people work so that the step height is about just below their, right where the tibial tuberosity is. And that's usually an okay height for everybody. If it's a little lower, it puts a little bit more strain through the front of the knee. So a little higher step gets more into the glutes, which takes some pressure off the quads as well. And if that height is too much, usually a kid can go a little higher, and then so not really higher than the knee, the joint line, but you can go a little higher and get a little bit more into the glutes, and it takes a little strain off the knee. It's a great ankle mobility exercise, going forwards, sideways, and then doing a curtsy so that you get all three dimensions in through the hip, the front, the back, and the side, and you get the rotation muscles as well. So step ups to me is one of the best exercises you can do for almost anything. If the knee's hurting, we have to adjust, the height of it, but otherwise, like as you get stronger, that gets less and less, and it's much easier to create movement in there. In the moment when it's really sore, ice can help to decrease it. Rest. If it's really inflamed and aggravated, hold off on jumping, hold off on, jump landings, whether that be tumbling or coming out of stunt or actual jumps, and just let your muscles rest and recover. During that time, if your team is practicing, then you should be working on your corrective exercises, work on your core stability, work on your rolling. Like there's things that you can do to get stronger so that the jumps actually don't hurt. But in the acute, when it's really sore, you need to unload them and let them rest. And I know it's frustrating, and you have to use your best judgment. Your kid really is in charge of how much is too much. If they're coming out of practice and they're limping, this is one of the red flags that's in the injury prevention starter kit. If your kid is coming out and they're limping a lot, it's too much. They've pushed too far, especially if by the next morning they're still having that pain. Tightness, soreness, that's not unusual, but that joint pain that's irritated, it's inflamed, that's more swollen, that's causing them to, favor it and really limp off of it. It's too much activity, and they need to roll it back a little bit. If they roll it back sooner, they're going to be back in sooner, and they're going to have less pain in the long run. So really pay attention to what they're doing as they come out of practice. Coaches, if you're listening to this, if you're seeing your athletes coming down and really favoring something, or if they used to have really solid jumps, but their landing now either is awkward or they're favoring their jump and they're getting worse, there could be something going on with their knee or their heel. And so have them get checked out, have them get into physical therapy so that they can learn how to start to move better and so that it's not continuing to hurt. I hope that's helpful. If you have questions, please feel free to reach out. And all these exercises, most of these exercises, actually 90% of these exercises are on my YouTube channel. So go scroll through there. If you want me to send you a specific exercise, just let me know. I can easily do that and find it quickly for you. They're also all in there. You can link to them all in the book. So if you haven't grabbed a copy of the book, you can grab a copy of that. If you want a signed copy, just fill out the form and I'll send you a signed copy with that as well. So crawling, rolling, balancing on two knees, balancing on one knee, keeping the core stable, building core strength and hip strength, and gradually, deloading as you need to until it just calm things down, whether that be for the knee or the ankle or the Severs, so the Osgood Schlatters or Severs. We just have to strengthen the core and the hips and get things to kind of quiet down. In the short term, stretching can help, but it's not necessarily going to fix the problem to make it long term. This is something that kids, they generally will grow out of the pain, but the dysfunction, if they're not controlling the core, they may still have that dysfunction, which may lead to problems down the road. So, and it's a growth thing. It's not anything to be worried about, but you can give them tools so that they get stronger, and it's not something that stops them from doing lifelong activity. So use your best judgment, seek help as you need to, and don't let it wait. All right. That's it for this week's episode of the Cheer Athlete. Don't forget, check out the Injury Prevention Starter Kit. It is now up on my website, so you can check that out, and I'll leave links for the book. And if you have questions about anything, there's an Ask a PT form down there as well. Appreciate you being here this week. If this was helpful, please share it with somebody. Don't forget to subscribe, and I'll see you next week. Have a good one. And don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. You are responsible for your own vibes, just like my friend Drew Keller used to say. Peace out.